Good afternoon. Today we're going to share some details on the efforts our communities are taking to push back against COVID-19 and an update on the situation with respect to unemployment support. First, I'll give a quick update on the latest COVID numbers. Yesterday, DPH reported there were 9,439 new individuals tested by molecular tests. That brings us to a total of over 1.8 million individuals being tested and over 2.7 million tests conducted. Massachusetts continues to be a national leader in the amount of testing we're getting done here in Massachusetts. We saw lower test totals over the weekend, but that's not surprising given that it was a holiday. Last week, the Commonwealth averaged about 42,000 tests per day compared to about 33,000 tests the previous week. Part of this increase is from college students and faculty getting tested as they return to campus, and DPH will start to report data for college testing shortly. The information will be updated every day and is another important piece of the data that we'll use to guide our response to COVID. The 7-day average positivity rate is very low at 0.9%. We're continuing to see excellent progress across the Commonwealth. But there are some communities, and we've talked about this before, that are continuing to see increased positive test rates. And in a handful of cities, we've been focusing on our efforts with local officials to deal with dangerously high levels of transmission there. Somebody just turn on the mic? Oh, okay. Over Labor Day weekend, we ramped up ground efforts in 5 communities that have been particularly hit by COVID: Chelsea, Everett, Lawrence, Lynn, and Revere. We launched a new set of tools through the COVID-19 Enforcement and Intervention Team to increase enforcement, education, and public health resources and awareness in these communities, and this included multilingual public awareness campaigns. These resources are being deployed in collaboration with local leaders and with law enforcement and local boards of health. We all have the same goal, which is to keep COVID out of these communities and to do everything we can to help keep their people safe. Over the weekend, we had field teams meet with residents and business owners in Chelsea, Everett, Lawrence, Lynn, and Revere to distribute information from those locations, and these field teams had about 35 volunteers at 16 locations across these 5 communities, from beaches and standouts in high-volume areas to church and food pantry visits to stopping by and visiting businesses with a lot of traffic like grocery stores. The teams handed out over 500 signs and 17,000 flyers with community-specific information on how to stop the spread and keep people healthy both inside and outside the home. They also distributed almost 4,000 bottles of hand sanitizer. This weekend, we'll also be adding Framingham to this group. In the 5 persistently high-risk communities mentioned before, the Division of Professional Licensure made 92 inspections last week across businesses like funeral homes and nail salons and barbershops. They found a total of 47 COVID-19 violations in these facilities, and the state police are assisting local police with COVID-related enforcement as well. Over Labor Day weekend, state police were in Brockton, Revere, and New Bedford to support local efforts, and they also launched dedicated patrols in DCR properties and on the water up in Gloucester. The Alcoholic Beverages Control Commission, known as the ABCC, is doing a terrific job of staying on top of compliance at licensed establishments. Just last week, those enforcement operations were conducted at over 1,200 establishments statewide. 900 establishments were found to be in compliance with the Commonwealth safety guidelines, and the others were fined or issued warnings. We're pleased that a vast majority of our restaurants and their customers are enjoying their experience, outdoor dining, indoor dining safely and appropriately to prevent the spread of COVID. And we really appreciate the ABCC's ongoing work to ensure that establishments are operating based on the guidelines and advisories that have been issued by the Commonwealth and by many local communities. Since August 11, our administration has released a weekly report and a color-coded map based on the number of new cases in each community, and each community has been designated as a high, medium, or low-risk community. Communities that have fewer than 5 cases aren't given a designation for what should be obvious reasons. We spend a lot of time focusing on the communities that are seeing higher rates of COVID to raise awareness and help those communities drive down cases. But it's also important to note that the vast majority of the 351 cities and towns in Massachusetts have done a great job following the guidance to reduce COVID-19. And this data shows that their efforts have been paying off. 190 cities and towns, or 54% of our communities, have recorded 5 cases of COVID-19 or less in the entire community since mid-August. 46 cities and towns, or 13%, have reported less than 4 cases per 100,000 residents. They're designated as low risk or green on our maps. And 47 communities have improved their standing in this assessment by reducing their percentage of positive COVID cases over the past several weeks. For example, Springfield has recently moved from moderate risk to low risk and has stayed green for the past several weeks. Salem and Saugus have also moved from high risk down to moderate risk and have done a lot of good work to get there. This demonstrates the solid progress communities can make if they focus on the many criteria and opportunities and protocols that we've discussed previously. And much of this progress has allowed us to significantly reopen much of our economy here in Massachusetts. And just want to commend our residents and our local officials for their effort to contain COVID, and especially the businesses across every sector who've stepped up and changed their operations to follow the COVID-19 safety guidance. This progress, with the support of many folks in the public health community and our pediatric community, now allows the Commonwealth to get children back to school for in-person learning as we begin the new school year, and it allows for several colleges to return to campus live, to learn in, and to work in our communities. As we've said, COVID didn't take the summer off, and we don't expect it to take off the fall either. We'll still be fighting it until there's a treatment or a vaccine, so everybody needs to continue to be vigilant and do the things that have proven to be so successful here. Wearing face coverings, practicing social distance, and staying at home if you're sick. Finally, I just want to provide a quick update on our work to distribute federal unemployment benefits that were created under a special FEMA program under a presidential executive order. The Lost Wages Assistance Program was implemented by a federal executive order in August, following the expiration of the federal Pandemic Unemployment Compensation Program. This program allocates funds from FEMA to provide an extra $300 in weekly unemployment benefits for claimants. Massachusetts applied for this new program last month and was approved. This approval applies to both the traditional unemployment claimants and to claimants under the Pandemic Unemployment Assistance Program, which was created by the CARES Act for self-employed workers, gig economy workers, and others who don't participate in what we think of as the traditional unemployment assistance program. Since the feds approved our application, the team at the Department of Unemployment Assistance has been working to develop the technical infrastructure and reporting capabilities that are required to implement the program so that we can distribute these resources. Eligible claimants do not need to take action to receive these benefits. They'll show up on a retroactive basis in your account. The retroactivity goes back to August 1st. Last week, Secretary Rosa Costa's team at the Department of Labor was able to start distributing supplemental benefits to pandemic unemployment assistance claimants. The PUA claimants received their first 3 weeks' worth of retroactive payments last week, and those benefits covered the first 3 weeks of August. Next week, those PUA claimants will receive the following 2 weeks' worth of retroactive benefits as well. So far, we've been able to distribute over $200 million in supplemental benefit payments to PUA claimants. That number will increase next week when the additional retroactive payments are made. Around 235,000 PUA claimants are now receiving this expanded benefit. Separately, under the traditional part of the program, the DUA benefits will be retroactively distributed as well over the course of the next few days. We're very glad that Massachusetts was able to quickly install the software and the technology and the reporting requirements that were necessary to stand this up and to make this work under this federal program. It's an important step in ensuring that we sustain supplemental relief for people who are out of work here in Massachusetts through no fault of their own during this pandemic. But as we said before, this program is a diversion from the FEMA program, which was appropriated funds for the so-called disaster attached to COVID-19, and it should not be considered, and isn't, a permanent or sustainable solution. As I said before, and so have many other governors, Republicans and Democrats, it's important for Washington to step up and do what they said they were going to do last summer, which is to implement a COVID-19 relief package that supports a longer-term, more traditional unemployment benefit program, and to support the states and localities that in many cases have borne much of the burden of making sure that their communities are safe. People in both parties need to come together to make this happen sometime soon. It's the right thing to do for workers who lost their jobs because of the measures many of us had to take to stop the spread of COVID-19, and it's critically important to ensuring that state and local governments can continue to support their communities as we work our way through the rest of this pandemic. Thank you. Questions?
With regard to some of the inspections over the...
Can you speak up a little, Sharma?
With regard to some of the inspections and the violations that were issued, do you expect to be releasing a list of where those violations happened and people can have a better idea?
I think we'll probably be able to put something out that'll give you a frame for what kinds of violations and how many. But I think we'll have to talk about whether or not we would issue. We don't normally issue, when we issue violations, they don't normally become immediately publicly available. I'll have to talk to people about that.
What is the concern about making them publicly available?
I just don't know what the standard practice hasn't been to do that. It would be a change in standard practice. We just need to talk about it.
Despite the fact that we have some towns that are still in trouble, in general, Massachusetts is in very good shape for a lot of hard work. What do you say to the people who are very frustrated? I know there was a Belmont restaurant owner that confronted you after our last get-together. What do you say to those people about the reopening and why we can't move forward right now?
Well, at this point in time in Massachusetts, the vast majority of our economy is open. Typically opening under guidelines and advisories, and in some cases on capacity limits that were based on guidance that was developed by the public health community. But I think it's important to remember that that phased reopening that we implemented here with guidance and the support of many of our colleagues in the business community and in local government began when we had a 10% positive test rate, and many people at that time said that it was reckless for us to open up with a 10% positive test rate, no matter how phased or structured that reopening was. And unlike many states where the reopening led to a dramatic increase in both total cases per capita as well as big increases in their positive test rates and significant increases in hospitalizations, here in Massachusetts, that reopening happened at the same, almost 500,000 people came back to work at the same point in time that we significantly reduced both our positive test rate and the number of cases that were being discovered per capita, and we dramatically ramped up our testing statewide over that period of time. I'm as frustrated as anybody about the fact that there are still elements of our economy that for one reason or another aren't open. But I mean, anybody who watched what happened in the South and in the Midwest with respect to bars and nightclubs should understand why, as much as those organizations are distressed and suffering under this current period of time, it was pretty clear they played a significant role in significant outbreaks and new cases in many states where they were permitted to open. I think the work that we've done to create ways for organizations and operations to open over the course of the past 3 months, and to do so in a way that has continued to maintain what I would describe as a safe Commonwealth of Massachusetts, is what we believed we needed to do to sustain that opening. I mean, one of the things we didn't want to ever have to do, which several states have had to do, is go back. You know, open people up and then tell them they have to have to close again. We haven't done that, and I think that's because of the guidance and the advisories and the careful way the reopening advisory group that was run by the Lieutenant Governor went about their work.
So what would you need to see to take another step and maybe allow, say, more dining inside and against cold?
Well, one of the things we've talked about is trying to get through the school reopening and the college return, okay? I mean, these are both really big and really important deals here in Massachusetts. They're hugely important for kids and for families and for educators, and the college return is particularly important as well for many people who work at colleges and universities. And I really think for the next couple of weeks, our focus really ought to be there. And we'll talk about other stuff when we get past that.
Governor, you mentioned Saugus and Salem as being a couple of communities that are doing better, essentially.
Springfield, too.
Springfield,
3 S's. I
wow.
don't know why, it just worked that way. Yeah.
If you could just describe kind of what's led to that. I know you've worked in these municipalities. And then also Everett, we know that there were 10 people hospitalized, according to the mayor, several in the ICU, one of the other hotspot towns.
I'm sorry.
I was asking about those communities that have gotten better. How did we get to that point? And then Everett, one of the other hotspot towns where the mayor has said there's 10 people hospitalized and several in the ICU. Just in the last day, they're still having issues there.
I think every community is different, okay? And it's hard to draw broad generalizations here, but you know, my wife and I went for a walk in Salem on Saturday, and there were a lot of people out, but there are signs everywhere about face coverings, and everybody we saw was wearing a mask. And we walked past some playgrounds, and we walked through the common, and people were behaving exactly the way you would hope they would behave with respect to distance and face coverings and all the rest. I do believe that this stuff works, and there's been plenty of folks in the infectious disease community who have said if people would just comply with the rules around face coverings and distance on a sustained basis at an 80 to 90% level over a month, we could kill COVID in the US. That hasn't happened. And I can't emphasize how much I think that plays a role here. The mayor in Salem has been, Kim Driscoll has been incredibly aggressive about messaging and working this issue with ambassadors. I mean, you can't walk down a street in the main core of Salem, it's downtown, without bumping into an ambassador who will be perfectly happy to provide you with a mask if you don't have one. I think the same thing has been done in Saugus, and Dom Sarno, who's the mayor in Springfield, has been incredibly aggressive about messaging and communicating and encouraging people to do the things that work. And in Springfield, for example, he closed down a few parks where he felt people just weren't taking seriously the issues associated with distancing, and didn't open them back up until he got commitments from the neighborhood that people were going to be serious about this. I can't speak specifically to what's going on in Everett, except to say that we've been working with the mayor of Everett. We're going to continue to work with the mayor of Everett. Many of the initiatives I talked about today involved Everett, along with Revere and Lynn and Lawrence. And we fully believe that if we all get on the same page here and work on these things, we can continue to reduce COVID cases in Everett as well.
Governor, the testing data in several states
been suspended by the state for returning 400 false positives.
Yep.
Can you tell us about that investigation and just your reaction to that?
Well, first of all, it was discovered fairly quickly. I think it was within 10 days of the first false positive that the DPH figured out there was an issue here and shut them down. And when you think about it, it's 330 false positives out of 1.8 million individuals tested. The long-term care facilities where that device was being used obviously were notified immediately and changed their programming and their provider to make sure that, and they retested everybody who tested positive to make sure they had the right information on those folks. And we fully believe that if we all get on the same page here and work on these things, we can continue to reduce COVID cases in Everett as well.
Governor, the testing data in several states.
Yep.
Well, first of all, it was discovered fairly quickly. I think it was within 10 days of the first false positive that the DPH figured out there was an issue here and shut them down. And when you think about it, it's 330
But I think the good news is it was discovered quickly, it was dealt with almost immediately. Everybody who tested positive was retested to determine if in fact they were positive. And I think the DPH has taken the right action with respect to the way they've dealt with this.
Will they be suspended indefinitely, or do you think they more trusted?
They're suspended indefinitely at this point, yeah.
Governor, several comments by epidemiologists are predicting a second wave of COVID this fall. Are the experts that you consult with in agreement with that, and is the state in a position to handle a second wave?
So there's a lot of scenario planning going on. I remember Ann Klebansky from Mass General Brigham standing here and saying a model is just a model, right? We've been working with the folks in the healthcare community and the public health community on a variety of scenario plans with respect to the fall because, I mean, actually no one really does know exactly what's going to happen here. Part of it depends upon how well we do with masks and distancing and all the other things we talk about. But the places where we absolutely want to make sure we're sort of teed up are around testing, where we continue to expand capacity and we continue to make sure as much of our testing as possible can be processed locally so that we can enhance and ensure that the quality of our turnaround times, even as our volumes go up, continue to be within 24 hours. And we continue to buy PPE. We continue to buy masks. We continue to buy gloves and gowns and all the stuff that last spring people were struggling to find. And we're going to continue to do that all the way through. And we'll scenario plan with our colleagues in the long-term care space and in the hospital space around both staffing issues and surge issues and sort of all the typical stuff that we learned from last spring's experience.
Governor, several states are either above or maybe hovering.
Say again?
Several states on the exemption list for the travel order. Right now it's 3, yesterday it was 4. They're above the threshold, not meeting at least one of the requirements. Obviously there are a lot of factors at play there that differ from day to day, but what is Massachusetts doing to coordinate with those states that might fall out of the exemption list? And when do you actually decide that it's time, to consider that these changes actually more of a long-term concern?
Well, we talk to, first of all, we follow the data every week. It's an every week review, and we make decisions on it based on the data as it's developed each week, and make adjustments if people manage to land in the right space for a couple of weeks. I mean, they need to create a little bit of positive progress there. But there's conversations going on between the states that are close and us on a pretty regular basis, the same way we have conversations on a pretty regular basis with Maine.
How much does that have to do with maybe reporting delays of positive tests that may not be from the present, or a concern that their rates are increasing again?
The best we can do is rely on the publicly reported data we get. And at this point in time, most states have had conversations with the COVID tracking project and with Johns Hopkins, which are probably the two most well-known baselines that are then used by many of the other folks who do a lot of the state-by-state comparisons. And we've said to a number of states, if you think your data isn't being properly organized and accumulated by either the tracking project or by Johns Hopkins, you should go talk to them, because we've done the same thing in our own circumstance where we felt it was important.
Governor, how do you plan on voting on the ranked choice ballot question? Do you support the concept?
Honestly, I haven't spent much time thinking about it at all. I've been kind of distracted by what we've been talking about today. We'll talk about that sometime between now and the election, but it's not going to be today.
Governor,
Maine has not yet given Massachusetts.
I know.
Do you know why? That, number one, do you know why? And also, is Rhode Island closer to coming off our travel restrictions?
I'll be interested to see where Rhode Island is today, okay? Because we usually take a look at this stuff on Wednesdays. They bounced around a lot over the course of the last few days. The main look, I think, I've said before that I think our numbers with respect to Maine are, I mean, we're one of the, I think we have the 49th, depending upon how you do the math. I think according to the federal data, we have the 49th, we have the second lowest positive test rate in the country, okay? And we are in the top 5 or 6 or 7, depending upon which one of these things you look at, in terms of our daily cases per capita. I think that would make us a perfectly appropriate candidate to get off the no-fly zone in Maine, but for whatever reason, it's not going to happen.
Are you going to be following up on that phone call?
We talk to them all the time.
Governor, your administration allows purchases made by contractors, minority-owned businesses, to be counted towards the contractor's diversity goals. Now, a lot of these companies, GBH investigations found, don't really seem to exist. Critics say that is tantamount to fraud. Do you agree that there's potential for fraud in the system or fraud going on?
We have a pretty decent program for following up on that stuff, and I disagree with virtually everything that was in the GBH report, and you guys should come spend some time talking to us about it.
The state labor board.
I think we're asking the
Go
same
ahead.
question, but the state labor board ruled that the Andover teachers participated in an illegal strike. Curious your reaction to that decision, and are you concerned we will see this in more districts where having protests every day?
So, sometime in July, maybe, the leadership of the 2 big teachers unions, the MTA and the AFT, had a series of meetings with the folks at DESE and with Commissioner Riley to talk about this idea of taking 10 days of the school year, 10 precious educational days of the school year, and applying them to training, okay? And in an unprecedented decision, DESE made the decision to take those 10 days, which are supposed to be about educating kids, and to make them available for teachers and administrators to get together and figure out the plan for whatever their district was in this year, okay? 10 days. Always been 180 days. Like iron, 180 days. And the commissioner said, you know what, given all the issues around all this, we should put those 10 days aside for training. And we'll agree to that. I think Andover made the right decision by arguing that a deal's a deal, that there was an agreement that those 10 days would be spent conducting the training that was necessary for however that school district was going back in, and I applaud the decision. I think it was the right one.
What do you say to the school?
Pardon me?
That's sort of a shot across the bow. I see this as sort of a warning to other communities that are considering school committee, school unions that are considering civil actions.
I think the DESE position, which is basically that it's okay to teach and to be in a basically empty building, is an appropriate decision. And I think all the data we have and all the advice we've gotten from our colleagues in the public health and the infectious disease and the pediatric community is that that's okay. And I think the decision that the board made was the right decision based on the deal that everybody agreed to. And I really think it's important to recognize and understand that the vast majority of communities in Massachusetts, because people did a ton of really hard work and made enormous sacrifices in many cases, don't have much COVID at all, are way below the norms that almost everybody anywhere in the world would apply for determining whether or not you could go back and teach and educate kids. And I think it's important that we recognize that.
Governor, do you support legislation to limit the fees that DoorDash and like where you can charge the restaurants, maybe to help the restaurants out in a tough time?
Honestly, Jonathan, I don't know much about that. I don't know much about that issue.
Apparently there's a House bill pending, I don't know, I heard a lot of.
I mean, the biggest question in my mind on this would be, does it help or hinder the ability of takeout? Because I think takeout has turned out to be a pretty important and pretty valuable tool, along with curbside delivery and pickup and all the rest, and bottles of wine to go and outdoor dining and all that other stuff, to give restaurants that are playing a really difficult hand the ability to continue to serve customers. I don't know the answer to the question I would ask about that, which is, does it make it better or worse with respect to our ability to support a restaurant community that's really been under an enormous amount of strain? I'd want to get an answer to that.
Governor, given the continued high unemployment rate in Massachusetts and the cost,
Say again, Matt?
given the high unemployment rate in Massachusetts and the cost we talked about earlier today about providing benefits to these, your administration is saying that UI insurance rates on employers could go up by 60% next year, putting a huge burden on companies. Would you support freezing those rates moving forward?
I mean, there are many outstanding issues around almost every element of state finance you can think of, and local finance as well. There's the UI system, there's tax revenue, there's the number of people who are working, there's the budget, there's federal funding and federal support, what it can be used for, both the support that's been given and what people are talking about doing. I think our goal here is going to be to do everything we possibly can to continue to provide services and support for people who need it during this period of time, and try and do it in a way that does the least amount of damage to an economy that's obviously struggling at this point in time. But there are so many moving parts on this that I would not commit to a particular answer to any of that at this point in time, other than to speak to what we're going to try to do.
Governor, the families of several people who died at the hands of police want you to reopen some of these past cases. They've been calling for that today at the State House. They want you to assign a special prosecutor to look at those cases. Is that something you can do? And if so, would you?
Okay, I'm not sure about legal authority here, okay, and I didn't know you were going to ask about this. It's always been my impression that the state official who has the most latitude with respect to reopening cases is the Attorney General. And I do know the Attorney General can choose to take cases that DAs either don't take or aren't interested in. I don't know if the Attorney General has the authority under existing law to reopen a case that's been closed. And as I stand here, I don't know if I do either.
Is the procedure any more planning in terms of any social unrest that can make its way to Boston? Is there any more planning underway right now?
I mean, our basic strategy and our basic approach to all these issues around protests and demonstrations has been to pay a lot of attention to what's trafficked around on social media, because that's where a lot of the messaging and the communication about events takes place, to talk regularly to our colleagues in local government about whether they're appropriately staffed and ready to ensure that whatever event might be going on in their community is going to be safe, and then if they ask us for help, to try to be there to support them. And I think that strategy in Massachusetts, with the exception of one night, May 31st, has worked pretty well.
So is planning always underway then?
Yeah, people are talking to each other all the time about this stuff.
Governor, Northeastern just kicked out 11 students for gathering in a hotel room that was like their dorm, not going to refund tuition for the fall semester. Is that too harsh, or is that what you'd like to see?
I think everybody knew what the rules of the game were coming in, and I think it's really important, especially during this time when kids are coming back to school, that everybody appreciate and accept the fact that college is just not going to be the way it was last year or the year before or the year before. And that is going to create a certain amount of dismay, I'm sure, for a lot of the kids who are there, but in this particular case, the rules were the rules. They were established up front. Everybody attested to them, and they broke them. And I feel terrible for the kids. I feel terrible for their families. Okay, but I think it's really important for the colleges. I mean, the colleges are spending a lot of money to test kids, a lot, and we worked really hard with the Broad and with others to create an enormous amount of testing capacity to make it possible for colleges to be able to do this with their faculties and with their staff and with their students. And we did that for a reason, because we wanted kids to be able to learn, we wanted teachers to be able to teach, we wanted people who worked at those colleges to be able to work there, but we wanted everybody to be able to do it safely. And I think this sends a pretty powerful message about that, despite the fact that it's obviously a really terrible blow for the kids and the families that are involved.
Governor, can you
Bruce?
clarify?
He's been trying to get to me here.
Last Friday, the Revenue Department issued some August numbers. Still surprisingly good compared to last year. And I know your response to Matt,
Yeah.
a lot of moving pieces, but what do you think of the August numbers? And also, when will we start to get, I mean, maybe the Feds never act. Don't you at some point have to pull the trigger and say, here's what we got to do?
Yeah, I think, so first of all, when you're working through an unprecedented time that no one's ever worked through before, predictions and projections are predictions and projections, which is why we're doing a lot of scenario planning as opposed to sort of trying to figure out exactly what we think is going to happen in the fall. The same is true with respect to the revenue stuff. I'll give you a couple of sort of just very high-level comments on this. The first is, because people are doing such a good job in Massachusetts for the most part around wearing masks and distancing and all that sort of thing, ear infections, sore throats, strep throats, traditional respiratory infections, a whole bunch of things separate and apart from COVID are just way down. And those aren't issues associated with people not going to the hospital or not going to the ER because they're worried about COVID. It's literally there's just a lot of stuff that traditionally ends up in the ER or in the hospital or in the doctor's office that isn't ending up there. And it's because there just isn't, people aren't moving around the same way, they're treating each other differently, germs don't have the ability necessarily to travel the way they have in years past. And as a result, healthcare expenses, which the Commonwealth has a ton of, right, are continually coming in below where we thought they would come in. And there's just a lot of other elements to this that make it very hard, with respect to Matt's question and yours, to say that this is an easy one to answer. It's not. And we're currently operating on a 3-month budget that expires at the end of October, right? There's a 1-month budget and then a 3-month budget that gets us to the end of October. And my hope is that sometime between now and then, and I know we have talked a lot with the legislature about this, we would like to get to the point where we know enough, is there going to be a federal thing or not, right? Are we going to continue to see movements with respect to tax revenue and spending that really aren't based on any changes we've made in policy? They're just a fact of the way the world's working in a COVID environment that can create a little more clarity around what a run rate really looks like. And I think the legislature and the administration working on creating a 4-month sort of, let's get some structure out there for cities and towns so that they can deal with their issues, was the right way to go. And we'll know a lot more in 30 days than we know now. And then I think we are probably going to have to put the marker down and say, okay, this is what we think the rest of the year looks like.
Governor, do you think the education law would survive this budget? As far as you can tell, I mean, there are a lot of things that need to be weighed as far as what takes top priority despite all these unknowns still.
Yeah, I mean, the first thing I'd say about that is between the federal money and the state money, cities and towns overall got way more money than the Student Opportunity Act would have proposed. Hundreds of millions more. Now, they also had expenses that they incurred that were associated with sort of getting ready for school that were different than the ones they expected to have. Now, how that translates in terms of expenses as they go through the year, in some cases it would probably mean they spend less on certain things depending upon how they open. In some cases they'll probably spend more. But I'm very proud of the fact that the legislature and the administration, between state funds and federal funds, were able to put significant resources into the hands of cities and towns and school systems as they work their way through this process. I think the question that, the next question this will ask is, sort of next year. And that's one we're not going to really be able to speak to until we get to the end of the calendar year.
In the spirit of this conversation, what did you think of the Senate Republican proposal that was introduced in Congress yesterday for $500 billion total?
I'm sorry?
In stimulus spending, the Senate Republicans introduced a pared back $500 billion stimulus package, well below the $3 trillion that passed the House.
Didn't the Senate pass a bill that was earlier in the year that was closer to $1 trillion? They did. That had $107 billion in it, I think, for higher ed and K through 12 education. I'm not sure what's in that thing, but I certainly think to do something and not include states and local governments as part of the picture just doesn't make a lot of sense, because the one thing I do hear from Washington a lot is they want to see the economy advance, they want to see the economy improve, they want to see people back to work. It's awful hard to do that if you're not offering support to the two entities in government, us and the locals, who have been investing an enormous amount of money in fighting and battling our way through this pandemic. I mean, to have us in a position where we're all heading in the opposite direction of what they want the economy to be doing as we head into the fall and into the new year just doesn't make sense to me.
Thanks, everybody.
The Democratic nominee before, Jake Washington, he worked for your campaign in 2014. He said he would be a partner to you in Washington. Do you plan to endorse in that race?
Again, that's something we can certainly talk about at some point. I certainly know Julie Hall and I certainly know Jake. And I would call them both friends. But I would hope, we have had a really good working relationship with our delegation, okay? Democrat or Republican. And I would hope that anybody who ends up in those seats recognizes and understands that when it comes to what's in the best interest of Massachusetts with respect to our relationship to Washington, I would hope nobody thinks about that as a D and an R game and thinks about it as what can we all do working together to promote the interests of the Commonwealth, because that's certainly the way we think about it. So no matter who ends up in any of these chairs, I really hope they get into that chair with the idea that they want to work with us and our colleagues to do what's in Massachusetts' best interests. Thanks.